Viruses are microscopic infectious agents that invade living cells and replicate inside them. While vaccines and antiviral drugs have controlled many viral diseases, some major human viruses still have no definitive cure, meaning no treatment completely removes the virus from the body once infection occurs. Some of these viruses remain hidden in the body for life. Others cause rapid and often fatal disease once symptoms appear. Presented in historical order of identification, these are the most significant viruses without a cure. Rabies virus, recognized in ancient times, isolated in 1885. Rabies is one of the oldest known viral diseases in human history, with descriptions dating back over 4,000 years. The virus itself was scientifically isolated in the late 19th century. Rabies spreads through the saliva of infected animals, most commonly via bites from dogs, bats, or wild mammals. After entering the body, it travels through the nervous system to the brain. Early symptoms resemble flu. Once neurological symptoms begin, confusion, paralysis, and hydrophobia, the disease is almost always fatal. Post-exposure vaccination can prevent illness if given immediately. However, once symptoms appear, there is no cure. Rabies continues to cause approximately 59,000 deaths per year worldwide. Marburg virus, identified in 1967. Marburg virus was first identified in 1967 after laboratory outbreaks in Germany and Yugoslavia. It spreads through contact with infected bodily fluids and is linked to fruit bats as natural reservoirs. Symptoms include high fever, severe weakness, internal bleeding, and organ failure. Fatality rates have ranged from 24% to nearly 90% in various outbreaks. There is no approved cure. Treatment focuses entirely on supportive care. Lassa virus, identified in 1969. Lassa fever was first identified in Nigeria in 1969. The virus spreads through contact with food or surfaces contaminated by rodent urine or droppings. Symptoms range from mild fever to severe hemorrhagic disease and organ failure. An antiviral drug can reduce severity if administered early, but it does not eliminate the virus. Hundreds of thousands of infections occur annually in West Africa. Ebola virus, identified in 1976. Ebola virus was first identified near the Ebola River in Central Africa. It spreads through direct contact with infected bodily fluids. The disease causes fever, vomiting, diarrhea, internal bleeding, and multi-organ failure. Large outbreaks, including the 2014 to 2016 West Africa epidemic, resulted in thousands of deaths. Monoclonal antibody treatments improve survival rates when given early. However, there is no guaranteed cure once severe disease develops.
HIV, human immunodeficiency virus, identified in 1983. HIV was identified in 1983 during the global AIDS crisis. The virus attacks CD4 immune cells, gradually weakening the immune system. It spreads through blood, sexual contact, shared needles, and mother-to-child transmission. Without treatment, HIV progresses to AIDS, which can be fatal. There is no cure because HIV integrates into human DNA and forms persistent reservoirs. Antiretroviral therapy suppresses the virus and allows near-normal lifespans, but it does not eradicate infection. HIV has caused tens of millions of deaths globally. Human papillomavirus, HPV, cancer link established in the 1980s. Although HPV was identified earlier, its strong link to cervical cancer was confirmed in the 1980s. HPV spreads primarily through sexual contact. Most infections clear naturally. However, persistent, high-risk strains can cause cervical and other cancers. Vaccines prevent the most dangerous strains, but there is no treatment that removes persistent HPV infection once established. HPV remains one of the most widespread viral infections worldwide. Hepatitis B virus, identified in 1965. Hepatitis B was identified in 1965. It infects the liver and spreads through blood, sexual contact, and mother-to-child transmission. While many acute infections resolve, chronic infection can lead to liver cirrhosis in cancer. Antiviral medications suppress viral replication, but do not eliminate the virus from liver cells. A preventive vaccine exists, but there is no cure for chronic infection. Hundreds of millions live with hepatitis B globally. Herpes Simplex Virus, HSV-1 and HSV-2, identified in the early 20th century. Herpes viruses were identified in the early 1900s. HSV-1 primarily causes oral cold sores. HSV-2 mainly causes genital herpes. After initial infection, the virus becomes dormant in nerve cells. It can reactivate periodically throughout life. Antiviral drugs reduce outbreaks but cannot eliminate the virus from the nervous system. Billions of people worldwide carry herpes infections. Varicella-Zoster Virus, VZV, identified in the mid-20th century. Varicella-Zoster Virus causes chickenpox during initial infection. After recovery, it remains dormant in nerve tissue. Years later, it can reactivate as shingles. Antiviral medications shorten outbreaks but do not eliminate the virus. Vaccines reduce risk, but there is no cure once infection has occurred. Nipah virus, identified in 1998. Nipah virus was first identified in Malaysia in 1998. It spreads from fruit bats to humans, sometimes through pigs or contaminated food. Human-to-human transmission can also occur. The infection causes severe respiratory illness and brain inflammation. Fatality rates often range between 40 and 75%. There is no approved antiviral treatment or cure. Care remains supportive. These major viruses continue to challenge global medicine. Some persist silently in the body for life. Others cause rapid and often fatal disease once symptoms appear. Despite medical advancements, these viruses remain without a definitive cure.